I'm going to start in 3, 2, 1.
Good evening, everyone. I am Benita Benjamin, Program Chair and Vice President of Omega Psi Omega Chapter of Alpha Kappa Alpha Sorority Incorporated. On behalf of our President, Latricia Garland, and the entire membership of the Omega Psi Omega Chapter, as well as our community partner, Share in New York City, I want to welcome you to our Fire Chat with our special guest, Dr. Ellen Grant, and our moderator, international and nationally known motivational speaker, Desiree Walker. Before we get started, I just want you to know that this is being live streamed and we're also recording this webinar. We also have a Q&A section, so you can also put your questions there and we get to as many questions as we can today. And we have a special presentation for you towards the end. So welcome, everyone. Desiree, you can take it from here.
Well, good evening, and thank you, Benita, for the opportunity to be here this evening and to create such an important evening for us. I think, many of us have experienced the pandemic. So I think, thinking about the impact of COVID on our mental health, it's a topic that we don't often talk enough about. And so I'm thrilled that you have given me the opportunity to be part of this. And I'm extremely excited to be joined by Dr. Ellen Grant. And so I just want to briefly share her bio with you before we get our fireside chat started. Dr. Grant has over 25 years in health, behavioral health, education, and human services. Her past leadership positions include Fellow, Say Yes to Education, National Office, Commissioner, Erie County Department of Mental Health, CEO of Niagara Falls Medical Center. She has taught at the undergraduate and graduate level in college and university positions. State University of New York at Buffalo, DeUville College. She is also a licensed clinical social worker and executive coach. Now, I just want to say that clearly as I go on, you will see that she is busy and she is doing a lot of great things. In 1988, Dr. Grant started First Advantage Consulting. Her business consulting includes healthcare, education, behavioral health, and wellness, and diversity, as well as executive coaching. She's an author. Her first book, Managing in Black and White, was originally published in 1991. She also authored a chapter in the book, Go Tell Michelle, African American Women Write to the First Lady. She has written chapters in other professional publications as well. In 2017, she has a publication, Management for You, Leadership Can Be Colorblind. And more recently, as of January of this year, she published The Female Worker's 14 Commandments for Powering Up Your Career. She's received numerous awards at both the local and state level, and she's currently serving on the Administration and Supervision Committee as well for national. She's a recipient of an honorary doctorate from Medill College in 1992. In 96, she was elected president of the New York State Association of Counties, the second woman and first Black in the association's 72-year history. And in 1997, the International Women's Forum Leadership Foundation selected her as one of 12 women internationally to participate in a year-long leadership training program that included training at Harvard University. She has done a lot of volunteering, but I just want to close out and say 3 years ago, she started the Diversity Servant Leadership Award to honor 3 7th or 8th grade girls for academic and good citizenship in the Buffalo Public School, charter school, and rural school. But 3 years ago, she also started Women Who Lead, a women's mentoring program to match mentors with mentees. And I won't want to be remiss in saying that currently she is the deputy mayor in Buffalo, New York. So without any further ado, I would like to say welcome, Dr. Grant, to this evening's Fireside Chat.
Thank you, Desiree. I'm really honored to be here. First of all, on the updating of our Juneteenth, finally federal celebration. And also today, the Supreme Court upheld the American Health Care Act, or Obamacare, as it's commonly known. And so now we know that healthcare, the way former President Obama envisioned it, is here to stay. So hallelujah, and God is good.
Awesome, awesome, indeed. And so, one of the things that, as we start off our conversation this evening, I just want to acknowledge that we have all experienced trauma from the pandemic over the past, 16 months. And I think that, it's important for us to acknowledge that it has not been an easy time, for us emotionally. And that many people have experienced a lot of different challenges. But we've also seen with this pandemic that people have, lost jobs. We've seen people not have access to health care. We've seen and heard about food insecurity and housing insecurity, and the list goes on. Many issues were definitely highlighted as a result of this pandemic. And so want to acknowledge the intersection of poverty, the lack of health care access, which was magnified through the pandemic, and how that has introduced trauma into our lives. And so I just would like you to share with us how we can begin to understand this period that we've been through, but also how do we think about the future? Because many of the cities around the country are opening up, as they call it, but we still are going to see an impact. And so how do we prepare ourselves?
Well, first, you opened it up so succinctly, but also all through the trauma, we have to acknowledge how racism is a public health issue and how racism has obviously impacted the care that people have received all through the pandemic. You mentioned food insecurity, but just most recently, Dr. Collins, the National Institute of Health director, mentioned that it just in June, a few weeks ago, he came out with a report saying that they unveiled a plan to eliminate a big gap in grants awarded to white and minority scientists to boost funding for research on health disparities. Because what's been happening is that Black researchers who wrote papers, they were not getting published as quickly as their counterparts who were white. But let's, talk about the fact that the trauma that we are experiencing is also embedded in what's going on with our own psyche and our mental health. We know that there 1 in 5 people is impacted by mental health issues. That 1 in 25 people are suffering from severe mental health issues. And again, the racism and the bias has been in healthcare since the beginning of time. We know this. But I just want to share with you something that I learned just a couple of months ago, that, we know that mental health and healthcare are all connected to race, of course. But you also may have heard of the 1619 Project to talk more realistically in our schools about the history of slavery in America. So one of the reasons we didn't have universal healthcare when we still don't have it, obviously. But one example was in 1945, President Truman wanted to expand the nation's hospital system, which then became the Hill-Burton Act, which gave federal dollars for grants to build hospitals and healthcare payments for those people who couldn't afford it. But Truman, because of the pressure he received from Southern Democrats, he gave in and allowed a lot of hospitals around the country to continue to segregate facilities. So we know that that's how the disparities began to grow, because the segregated hospitals obviously did not get as many resources as the white ones. And we know how long it's taken for even medical schools to admit our people of color. So, let's continue to realize that, as I'm sure we all do, that racism is a public health issue. And just to share some more of the data, I don't want to overwhelm you with data, but just to cite a couple of things. Did you know that African American women are 60% more likely to have high blood pressure compared with non-Hispanic white women? Now, everyone on this web tonight, this web call tonight, either you or someone in your family that is suffering now or has suffered and is on medication for high blood pressure. And a lot of that is ingrained in the fact of the daily strife, the daily little drip, drip, drip of racism and being discounted, etc. Plus the fact that during the pandemic, that the majority of people of color were not able to work from home. They were first liners. They had to get up. They had to get their kids out to school when they were going to school. And then when we were all shut in because of the pandemic, they had to figure out how they were going to feed themselves. Some of them had to stop working because they couldn't find childcare. So all these issues are ingrained in the fact that persons of color continue to, get the short shrift of equality across the board. So I know I put a lot of things in my comments, but Desiree, you're the moderator, so pick it apart and we'll go at it.
Yeah, so you gave me a nice segue, because one of the things, it's true, hypertension is definitely rampant in our community, and obviously stress is a factor, and so many other things. But one of the things that I would like you to touch on is, you spoke about, the lack of the opportunity to work from home. And what does that mean to be an essential worker in a pandemic? And so what I'd like you to speak to, which, I think many people experienced, especially early on in the pandemic, when we had to shelter in, is anxiety. But many people don't really know what the symptoms or really how to describe anxiety, but it's something that's experienced. And so I was wondering whether or not you could speak to anxiety and how that plays out in day to day with all the different things that are coming at us.
Sure. Well, anxiety is just a general feeling of unsettledness. Okay. You may be very anxious in your sleep. You're not able to sleep well, or you wake up every hour, or you break out in hives, or you're short-tempered. You're not eating well, or you're into the fact that you're overeating or undereating, or you're self-medicating, for example, because you have a feeling of jitteriness. You don't know how to make a quick decision. All of these things are generalized anxiety. Some people aren't able to work because they can't get out of bed, because they may be so unable to deal with the uncertainty brought on by the pandemic that they can't get their kids, out to school because they're stuck at home. And so they're trying to figure out, well, I didn't even finish 8th grade. How am I going to teach my kid from home, even with the teacher sending me information over the internet? But I don't have internet. So we're using our phone trying to do the schoolwork. And maybe you don't even have broadband in your neighborhood so that your phone keeps going in and out. You can't look for a job on your cell phone because you're using it for your child's schooling. So all of these things are, the impact of generalized anxiety. And when you have this feeling of uncertainness and you're trying to figure out, well, how can I calm myself? Well, a lot of people use alcohol to calm themselves. Okay. And we know what happens with that. Then you end up, having a lot of issues, plus the expense of buying it, or using over the counter drugs. Too many over the counter drugs. Um, you know, there's all kinds of vitamins now saying take this, and it leads you right into it by saying this will help calm you. Well,
Right,
some people say, okay, one didn't work, so maybe I'll take two, and
right.
so on and so on and so on. And then, not to mention the fact that the amount of people who overdosed with illegal drugs trying to calm themselves because of anxiety. So we all know a neighbor or somebody in our circle who has not been able to cope and has turned to illegal drugs or overuse of over-the-counter drugs or even prescription drugs, going from doctor to doctor to get another anxiety reducing medication.
And so thank you for that, because I think one of the things that I've encountered over the past year is that people were having feelings but really couldn't put words to it. And so I just really thought that it would be important to really explain what anxiety could look like,
Mhm.
so that if people are experiencing it, they can recognize it and put a name to it, and perhaps that will lead them to have the option to get some sort of care
Yeah,
for it and
get some
support,
care.
because now they can explain what it is and call it by name.
Yeah, I also want to add that because of the anxiety, and you may have read this, that there's been an increase in domestic violence as well as child abuse, because people are so anxious or trying to deal with all the uncertainty that they're taking it out on their child or their spouse. And we end up in the courts, or people end up in the hospitals with broken arms, etc. I don't need to go into the details, but child abuse and domestic violence has also increased during the pandemic. I
Yeah,
mean, you're
no.
out of work and you don't know how you're going to get your next meal, and you've got six babies to feed, and children aren't still, they can get on our nerves. And so the next thing you know, people are, some parents are hitting their child, and um, or the spouse is hitting the wife because he or she doesn't know how to deal with the anxiety and stress that they're under.
And so, we definitely will, be providing resources, later in the program as well. But so people can, potentially have that to support them if anxiety is something that they are experiencing. I'm going to call it the D word. There's another aspect of emotional health that we don't necessarily understand and or speak enough about, and that is one of depression. And so, can you give us, a definition of depression? Because I think that some people believe depression means that you're suicidal, and some people will not necessarily recognize that they are experiencing depression because they're still functioning.
Mm-hmm. Mm-hmm. Yeah, and you probably saw some of the commercials about the fact, of what depression looks like, and just take this medication. Well, maybe you're not at the point where you need medication, but you know that you're sleeping too much, you're drinking too much, you're eating too much, you're sleeping out so much that you can't get out of bed to feed your children, or you can't get the laundry done, or you don't understand why you're so tired, or why you can't do the simplest of calculations, doing your budget, paying your bills. This is how it presents itself. And depression can also present itself in the fact that you're short-tempered also with people around you, not calling in sick to work, etc. if you were working. So those are just some of the signs of.
And so I just would like you to go a little bit further to say that if someone is experiencing any of the things that you've just mentioned, what would be their course of action? Is it their PCP that they should speak to about this, or how would they go about trying to seek therapy and evaluation to determine where they are on the spectrum of depression, because the depression is a spectrum. It's not just one type.
Yes, absolutely right. Every single community, and all you have to do is just Google it, has a mental health hotline, or there's even a national hotline. And actually, depending on how, if you are feeling like you want to hurt yourself, there is a national suicide hotline which you can Google. But every community has resources where you can just call up and talk to someone. In my community, it's called the crisis hotline, where you can just talk to somebody 24/7. And I do pray that that is in every community for every caller who's on this line, where you can just call up and talk about what's going on with you. And that person on the line will direct you to where you can get the best help. Now, you may have heard of several of the telehealth programs out there. There's Talkspace is one, BetterHelp is another one. Depending on the kind of insurance you have, you can call up, and again, someone you want to talk about what's going on with you. How are you feeling physically? How are you feeling mentally? Then they can give you the best direction of how to get some help. But please be assured that there is help out there for you. You just have to take that, make that first step, or else work with somebody to help you to make that first step, to reach out, talk to somebody and find out. Once you talk to an expert who can tell you, guide you through what's going on with you symptom wise, it might even be your general practitioner. You can also, if you like, call your general practitioner, the person you go to for your annual physical. Call them for an appointment, go and talk to he or she, and they will direct you or decide if you're at the point where you may need some medication. Okay, so every general physician has a basic understanding of mental health and depression, anxiety, anything going on in that spectrum. Um, Even an allergist, quite frankly, would know to direct you to get somebody, get someone who can help you with your issue. But
Before I move on, I just want to highlight or acknowledge, that in our community, we as women have been taught, that we're supposed to be caregivers, we're supposed to be nurturers, that we basically are just supposed to make life happen. And we aren't necessarily taught to complain, and we're not necessarily taught to ask for help. And so, I would ask you, in the work that you've done, how do we address that? Because I really would like this audience to get comfortable, right? In knowing that it's okay to say, I'm not good.
yeah,
It's okay to say, I need help. And how do we begin to have a shift in our mindset and our approach in terms of how we deal with ourselves?
mhm. Well, first of all, I believe in the concept, and I hope all of you women on this call understand that self-care should be important in your life, okay? Yes, we're taught to be the caretaker, the nurturer, mom is everything. However, if you get sick, who's going to take care of you? You can't take care of anybody if you get sick. So the first thing you do, you know how they tell you on the airplane,
Right.
If if the oxygen mask drops down, put it on yourself first, then put it on your child. Because if you don't put that oxygen mask out and pass out, who's going to be there to take care of you or the child? Okay, so somehow, somewhere, you have to figure out, how can I get more self-care in my life? Is there a neighbor that I can switch off some days where you say to the neighbor, you take the kids to do some play things with today, and I'll take them tomorrow. Is there an opportunity for you to, I can remember when my son was, I think it was maybe about 4, and and it seemed like I had a busy work day, and my son was at me and my husband was at me, give me this, give me that. I went into the bathroom and shut the door for about 20 minutes and got myself together before I came out. That was my happy place, having to shut myself in the bathroom. So you have to figure it out. What is it that works for you? Because again, if you don't take care of yourself, you're not going to be there to take care of others. So that's the first thing. The other thing that we do is we say, well, I don't want people to think that I'm weak or that I can't do it all. Well, I have to tell you, Superwoman left the building 2 weeks ago. So, there's no such thing. So don't think that you can do it all and be it all, because you really can't. None of us can.
How true. I like to say, I've had just briefly, I've had a bout with cancer, and I've said often, that it caused me to realize that being a superwoman was overrated, and I needed to retire that cape that I was wearing with the S. And so,
Amen.
I definitely, agree with you that, we do need to be mindful, of our bandwidth, and when we can and when we can't, and we need to be comfortable saying no. I always like to say that, sometimes, we are concerned because 2-year-olds, all they say is no to you. But I say they might be onto something, because, we might be able to learn from them that there are times that it's appropriate to say, no, I can't. As opposed to seeing your plate brimming over and you keep piling more things on it, at the end of the day.
Yeah.
But as we talked about, anxiety and depression, and the reason why I brought those two up, because they definitely surfaced, during the pandemic. But I want to really just step back a moment, and just say, mental health, still has a stigma,
Yes.
in 2021. It shouldn't, but it does. And so I think, as a result of that, there are certain myths that we have, about mental health, and I'm sure we've all heard it at some point. Someone say, "Oh, that's my crazy uncle," or she crazy, right? And we say that so casually, not really understanding what someone may be going through. And so can you really speak about some of the myths, that we have in our community, as it surrounds, or relates to mental health?
Absolutely. And it's one of my favorite topics, because I used to hear some of the wildest things. But one of the myths was, will we know it? Well, first of all, will we know it when we see it? First of all, I mentioned some of the symptoms: trouble sleeping, change in personality from being your usually pleasant self to now moody, argumentative, even physical complaints like stomachache, headache, um, you know, having trouble mobilizing. Also, alcohol use. I mentioned legal tranquilizers, over the counter meds, even abusive behavior. Another myth: I've never seen it around me. Well, let me tell you that 20% of white adults, 16% of blacks, 15% of Asians, 17% of Hispanics and Latin, 27% of mixed racial, 37% lesbian, gay, bisexual. So yes, it is around you. Okay. Another myth: it's God's will.
Mm,
I just have to leave it to him and not worry about getting the vaccine, for example. Well, the Bible reminds us that God helps those who help himself. And though the Bible also says in Jeremiah 29:11, quote, for I know the plans I have for you, plans to prosper you and not harm you, plans to give you hope in the future. But I also believe you or your designee must take the first step to gaining that better future, to working out the plans that God has for you. Another myth, no place to get help, or no one to help me. Even if there's no physical location identified, I mentioned again, look in your local community, Google it. There's telehealth, there's online care. In this method, all you know is the counselor's first name. For those of you that want to try telehealth online, you just know the counselor's first name. It's very confidential. They don't know, even where you live. And you can talk to this counselor by mail, I'm sorry, by email or chat line. And if you're shy, you don't even have to show your face if you don't want to use the video screen. Okay, so those are some of the myths, but also along with that, I want to add a couple of the myths and issues that are coming up with COVID. And these are being expanded upon in social media, particularly in the young age group between 18 and 35, where folks are just circulating these false things like don't get the COVID vaccine because it'll change your DNA. Don't get the COVID vaccine because it'll make you infertile. Both women and men are saying these kinds of things, or it's a hoax, or they're just doing that because they're trying to kill the Black people. I mean, really, believe in science. The science is out there. Vaccines have been around since the beginning of time. I mean, you can't even get your child enrolled in school unless they've had the chickenpox vaccine, etc. So this is no different. And if you're over 50, you should have had by now the shingles vaccine. So there's another vaccine. These are no different. They've been tested. We had some problems, of course, with, them expiring, or in a couple of young folks, very, very small percentage of folks having some myocardial heart issues. But folks, I mean, wouldn't you rather have a shot as opposed to walking around being in bed with a ventilator and having to pay that expensive hospital bill?
Mm.
So, as the kids say, suck it up and get the shot. I'm, you know.
Fair enough. Fair enough. No, and I agree. One of the things that I often say, and perhaps you'll agree with me, that it's so important for us to be informed, and that we that our understanding of things are based on facts, and as you spoke about, evidence based on science. And so I do think that we owe it to ourselves to make sure we do the research in order to understand versus the sound bites, and to your point, what's circulating in social media that hasn't been verified. To take that as fact is not necessarily a good approach at the end of the day. But one of the things you were talking, which brought to mind also a challenge for some. Many of us are part of what is called dysfunctional families or dysfunctional relationships. And that weighs in as well. And so I think, if you could speak to how will someone, you cited many of the symptoms or the signs that people will have that something's not right and that they should seek some help to get further evaluation. But I also realize that we may have people who have always been in dysfunctional homes or relationships, and so they can't necessarily distinguish what should be normal versus what's not. And so what could you say to them in order to help them be able to evaluate their circumstance and address it appropriately?
Right, right. So maybe you're in what I would call a codependent relationship with another partner, male or female, and your your partner is giving you a lot of negativity, talking about you, like you're no good, or you're too fat, or I don't know why I'm still here with you. And I call that kind of verbal and psychological abuse.
Abuse.
It doesn't even have to be physical abuse. It can be putting you down constantly giving you a lot of negative feedback, where you then begin to believe that feedback, but you're afraid to leave the situation because you don't have any other fallback. You don't have a B plan. You don't have anywhere to go. Well, in those instances, again, calling that mental health hotline can help you get out of that, what I would call domestic emotional abuse, where you're going round and round with this partner. Or you leave that partner and then you go back to that partner because, oh, he was just having a bad day. You'll say, or she was just having a bad day. So you go back, you give them another chance. The same cycle keeps repeating itself over and over again. And quite frankly, the research says that a person in a domestic abuse relationship sometimes has to leave as many as 5 times and go back before they finally break away. But those helplines, there is usually in most communities, I hope, a domestic shelter where you can go and be safe. And you can go there anonymously and not have your partner even know where you went. You just call the hotline and then they help you steal away quickly. Sometimes in the dead of night when that person is sleeping, um, where I've seen it happen. But you're right, the dysfunctionality, sometimes it's hard to break out of because you don't have a B plan. So you have to
Yeah.
sometimes plan ahead, start socking your money away if you have any money that you can spare, or figuring out your own escape plan, how you're going to get away. And
Yeah.
that's just,
No.
one form of domestic abuse, just the emotional negativity that continues to go on. Or the person is keeping all the money, so you don't have
Right.
any access to any resources at all. Still calling that hotline can help you find a way to get out and get an escape plan to be safe. And even with children,
And so
there are a lot
yeah,
of
I appreciate that, and I want to just we talking about partnerships, couples, etc. But I also would like you to just touch on children. What because during this past year, in terms of the impact of not being able to go to school and see your friends, not being able, perhaps, if being social in terms of whether it be sports, whether it's music,
Yep.
whatever the different outlets your child or children may have had, that became very limited. And so can you speak to how a parent could actually be able to zero in on their child's emotional health, as a result of the change in the world, so to
Mhm.
speak, for their child, and I would assume it can vary based on age.
Yeah, it definitely varies based on age, but I will say right off the top that we have seen an increase in depression in children because during the pandemic, and in fact, the number of females who have been attempting suicide in the last couple of years has been increasing. So, but definitely some of the symptoms, first of all, know your child. You know when your child's not eating well, not sleeping well, having nightmares, not wanting to sleep by themselves because of their anxiety, they don't know how to express the anxiety. Bedwetting occurs. Um,
Mm.
Hoarding of food because they're afraid they may not have any for tomorrow. Things like that, or hitting their siblings. Um, those are just some of the simple things that we see. Or not wanting to get on the Zoom. I mean, the kids, can you imagine? I mean, we adults going to being on Zoom meetings after Zoom meeting, we get tired. Well, how do you think the kids feel? And I'm sure your parents out there, you already know what's going on with those kids. Say, I don't want to get on that Zoom thing today. You may have to bribe them, or maybe they have tantrums and start crying because they don't like it, or they don't understand, or they're not connecting with the teacher. So you'll know, hopefully know your child and know that you need to get some help for your child.
Indeed. Well, before we, I'm just going to ask, those of you, because I know Dr. Grant is looking forward to answering as many questions from the
Yeah.
audience as she can. And so I'm just going to ask you to use the Q&A box to type in your questions so that we can, get them answered for you. And while you're typing in your questions, I'm going to also ask another question of you, Dr. Grant. You spoke about, the individuals who did not have the luxury of working from home and that impact on their emotional health. But I would also ask you to talk about the individuals who were able to work from home, but now they were working from home with 5 other people potentially being in the house, and whether they were roommates, whether they were family members, and so a couple people were working, some were trying to do schoolwork, maybe there's a next generation there, and so houses, apartments, started to get very crowded, and people who did not have who weren't accustomed to spending a lot of time together, well, now we're forced to. And so, what would that look like or be at the
Yeah.
end of the day in terms of coping with that change?
Well, we already know, first of all, I'm going back to the statistics. I don't have the exact number, but the number of separations and divorces for spouses that were living and working in the same space has increased, okay?
Mhm.
As well as the number of partners wanting counseling. But can you imagine having all those people in one space trying, I'm sure looking at the New York, I mean, I saw it on a commercial where the woman was, she was using her bedroom for her office space and also trying to homeschool her 2 children. And the biggest room they had was the bedroom. And that was,
Mm.
the all-purpose room. So, I mean, I give it to her for being ambidextrous and being able to juggle it all. But it really is very stressful trying, as you can imagine, trying to work from home in a shared space. And sometimes, if you only have one desktop computer, you have to share the time and figure out, okay, I need this for my work from, like, say 9 to 12, and then I'll have to tell the office I only have one computer, and then I'll have to give it to my child so they can get their schoolwork done, etc. I can't imagine. I mean, so many of us are blessed to not to have gone through that. But for those of you who are going through it, you certainly have my empathy and my sympathy. And just trying to work it out, just trying to get a contract, a verbal contract with everybody in your living space about who's going to do what. I mean, I grew up in the projects, and there was one bathroom for 6 kids and 2 adults. And we had to have assigned time to get in and out of that bathroom. And I, I'm sorry, if I wouldn't want to be the one who was over the time, because mom and dad would be knocking on that door. It would be very uncomfortable for you. So once you had that time, that was your time to get in and out of that bathroom. And to this day, I now have 2.5 bathrooms living by myself because I've been so traumatized by having that one bathroom as a child. But anyway,
Understand.
that's my 2
No,
cents.
no. No,
But
definitely
again,
understand
get your
that.
own contract with all the people living under your house, so you're not all fighting, about who's going to get what time.
And another thing that I think many of us in the community or have experienced or may be experiencing now, those that were working from home, many businesses are now saying that they want their employees
Yeah.
to come back.
Mhm.
And to your point, some people have been vaccinated, other people have not. And there is still a level of anxiety out there about safety. So what are your thoughts in terms of how do individuals start to prepare themselves emotionally to return? I'll say return to society, i.e., to go back out to work
Right.
in a few weeks or maybe in a few months?
Sure. Well, a lot of companies, and I hope this is the case for all companies that are doing this new transition. I call it a reset. You know, people are saying, well, let's go back to normal. Well, to me, there was no normal. This is a reset. It's an opportunity for you to recharge, to look at your life and figure out, you know, is this the life you want now and in the future? But anyway, a lot of communities are going, companies are working with their human resources department to figure out how are we going to engage our employees so that their workplace mental health is taken care of because of the anxiety that folks are feeling about going back into an open environment in the office. Now, a lot of companies are saying we are not going to mandate that you get a vaccine before you come to work, but we're encouraging you to get the vaccine. But folks are generally feeling a little anxiety because, you know, a lot of supermarkets are saying if you're fully vaccinated, you don't have to wear a mask. If you're not
Mm,
vaccinated, then you must wear a mask. But I have to tell you, I have a distrust about people in their health status and what they will share and not share. So how can you be 100% sure that that person is saying, "Well, I've been vaccinated," and you know, I'm sorry, some folks are just gonna lie. Okay,
true,
so I mean,
true.
the companies are working with the employees, and the best companies. In fact, there's on the work resource, work the resource sheet that I'm going to share with you, there's a website called Workplace and Mental Health, where a lot of workplaces are taking into account their own employees' mental health, working with the employees and doing surveys and saying, what would make you most comfortable coming back into the office now that we're post COVID, this post COVID period? You know, how can we make you feel more comfortable and more at ease? Do we come back 5 days a week or do we start gradually by saying come back 3 days a week and then for now, and then maybe in the fall, November, everybody comes back
Right.
full days, 5 days a week.
Yeah. So, you know, one of the questions that came in, how can you help a family member who is struggling and having breakdowns, but refuses therapy as an option?
Well, it depends on the level of the breakdown. Most states have what we call a 941 in New York State, where you unfortunately have to go through the court to get the person out of the house. Now, again, it also depends on if you have a crisis hotline in your community where you'll call someone and you'll tell them what's going on, and then they may come with a counselor and sometimes with the community police to see what's going on. It just depends on the level of crisis that the person is in. If the person is saying, I'm going to kill myself, well, that's a red flag. You've got to get somebody, call the crisis hotline, tell them that the person is threatening to hurt themselves, and the mobile crisis unit, and again, most communities have this, will come out and evaluate the person in the family. You know, you've seen the reality shows where people take an intervention and actually physically remove the person and get them to an emergency room to get evaluated. And sometimes that you have to do that.
Understood. And so the ability to work from home has been a blessing since many are without jobs. But how do you create balance when working from home? Many people have, you know, struggled with that. Any recommendations or suggestions?
Yeah, well, a lot of companies think that, well, gee, you're just working from home, so I can have access to you. This is the boss saying this. So I can have access to you 24/7. You know, you're just working from home. You know, you got free time. Well, no, you don't. First of all, you should structure your day. Get yourself on a schedule. Make sure that you take time out to have your lunch break working from home. And then come up with a time that you know you're going to stop working. Okay? Because a lot of people I've spoken to say, well, I'm working until 10 o'clock. Well, whose fault is that? It's your own. Just because, or you're feeling guilty because you're working from home, you feel you have to put in those extra hours. No, structure your day, take a break just like you would at the office. You go down the hall to get your coffee, go downstairs in your house or across the hall to your kitchen, get your coffee break or your tea break, and or sit outside on the patio for a half an hour, just like you do for those of you that are smoking or doing other things like that and going outside to do it. Structure your day. Have a defined time that you agreed with your company that you're going to stop work, and then turn off the technology. I People that know me know not to call me after 8:30 p.m. and that includes my family. So it just goes right to voicemail.
And I would just, add to that, one of the things that I think many of us struggle with is having healthy boundaries. And that's what you seem to have really, spoken about, the need to create them, and then to make sure that you follow through.
And as you said, Desiree, learn the word no. It's N-O. That's it. There's no explanation after no. You don't have to say, well, I really don't want to because A, B, and
Right.
C, and D. No, no is one word. That's all you have to say. No, I'm sorry. Or just if you want to be kind, say, I'm sorry.
Right.
Say no.
No, that is true. And so, the other thing, thinking about, the entire family, and different relationships, and some of us may be at a point in our lives where we're supporting elders, whether it's parents or grandparents. And I think that this pandemic has created something else for them. I think, and although they may have lived long and have experienced a lot, this is still something that they could not even imagine. And so my question is, how do we, as we engage with our elders, how do we assess their emotional health in order to be able to help them, or guide them? Because again, I don't necessarily know many of the older generations would do the telehealth or do the therapy, etc. But what can we do?
Well, what you can do is first of all see what's going on in the community for those elderly folks. A lot of the community centers for seniors, of course, were closed down. However, a lot of them in a lot of communities are still trying to engage the seniors because the amount of, you can imagine, social isolation that seniors are feeling because of the pandemic has been increasing. And a lot of them go through the depression too, not wanting to get out of bed, not wanting to eat, etc. So if you can do some FaceTime with your family, that's important. But also see what resources are in that community for seniors. Even during COVID time, and I know in my community, we had a city Department of Senior Services, and we divided up the citizens with their phone numbers,
Mm.
calling them at least once a week to find out if there was anything that they needed. Then the city also, we came up with what we call door knockers, where you just, it was a card with all kinds of phone numbers on them that had where they could get services or who they could call if they needed, if they ran out of food, if they needed a home delivery, if they needed their sidewalk shoveled, all listed through the city to, again, connect our seniors. Also, let me not forget to remind you, the AARP has its own website, has before a number of resources for seniors to get through the pandemic and things that can help them.
Okay. And
Also,
so,
to start a phone line,
mm,
a book club. In one community I read about, they had their own book club, and basically what you can do is get an 800 number, free. There, if you just Google free 800 number, you can get an 800 number, and all of your seniors in that particular community. You don't want to have too big a group, but
right.
maybe 8 or 10 of you, 5 of you, will say, let's read this book this month, and then you all call this 800 number and talk about the book together.
No, that's a very, very good idea. And I think, one of the things that has been important or necessary in this time is creativity, right? We have to definitely try to think outside the box on how we can do things differently, in order to, engage, but also to support one another, at the end of the day, being that so many things were taken away, and understandably, but taking away for a certain time period in life was definitely very different.
Yeah.
And so I would just, ask if there are any other questions, before we look to wrap up. We'll be happy to answer them. So please use the Q&A chat box, or Q&A box, not chat box, the Q&A box, to enter any last minute questions that you would like to pose to Dr. Grant. And then the one thing that I would ask you, as we are looking to wrap up, what words of encouragement or affirmation you could leave this group with, because the reality is that we all will experience a low point at some point during the day, during the week, during the month. And so we need to be able to have the tools in order to make sure that we stay healthy emotionally.
Yes. Well, my favorite line that I like to use, and sometimes when I'm feeling down, I remember to say it, is keep an attitude of gratitude.
Mm.
In other words, you may not have the best job, but maybe you've got a great family, you've got a roof over your head, you've got food to eat. So every day, end the day by keeping and wake up in the morning saying it too, an attitude of gratitude. And another thing that I recommended as a therapist is to keep a gratitude journal. Every night before you get ready to bed, list 3 great things that happened to you today. And they don't have to be something that you bought. Say it was a great sunny day. Say I had a great ice cream sundae. That's one of my favorites. Uh, or I had a great meal with my family, or my son just graduated. Just 3 things that you can end the day on a positive note on. And write them on your calendar, or just have one of the those black and white marble books that you can get at the dollar store, and date it and write it. And you'll be surprised, looking back 6 months from now, you'll be reminded that you already came through the fire. And Winston Churchill, and I don't really like to quote him, but he did have a great saying that said, when you're going through hell, keep on going, because you will come out of it.
Indeed. Well, in recognition of having an attitude of gratitude, I am grateful to have shared the screen with you this evening and heard, the opportunity to speak to you, but to hear the insights and the perspectives, and just really touching on the topic that we definitely need to talk more about. But I do appreciate you being here, and just want to say thank you. But I also want to thank the audience for spending the evening with us to really listen. And we hope that something that we've said will definitely leave a mark, so that people now feel as if they have some perspective, a different perspective if that's necessary, and they've acquired some tools so that they're able to keeping on and moving through the fire at the end of the day.
Amen. It's been my pleasure to work with you, Desiree, and I look forward to hearing more about you and the phenomenal things you're doing to support other women in the community.
Thank you. And so, I like to welcome Benita back, Benita Benjamin. Again, thank you for the opportunity, and I'll turn it over to you.
Thank you. Thank you, everyone, for joining us. Dr. Grant, thanks for accepting the invitation and for having such a frank and open conversation about mental health. I greatly, greatly appreciate it, considering how busy you are, for you to take the time out today. We appreciate it. Everyone, have a great evening. There will be a brief survey for you to answer. We greatly appreciate your feedback. Thanks again. Have a wonderful evening.
Good night.
Thank you, everyone.
Bye-bye.